This video will show you a complete shoulder stretch routine to prevent all the following injuries. Now, you can get started by stretching your lat against the wall or a door. You can begin by taking your right hand, keeping it straight up in the air, and you can follow it by leaning towards the wall. Now, you should feel a big stretch on the right side of your side. You're stretching the Latissimus dorsi. This is a very important one. If you have a rotator cuff injury and you can't perform this exercise, please don't. This next one, you're also going to need to use the door. It's called the pec major stretch. You're stretching your largest muscle in your body, one of the largest muscles in the body, your pec major chest stretch. Now, what I want you to do is try not to lean on it. Now, you want to keep your feet a little bit forward and pretend that your torso is moving before your hips or your knee. So you want to do a slight bend on that left knee, and as you're doing it, you should feel it on the outside, above like your shoulders, your chest area as well. This one's just a different way to do it. If the other one was too challenging, performing this one will also stretch your shoulder flexors and internal rotators. By keeping a fist against the doorway, you should feel a stretch on your chest, on your bicep. Now you want to make sure that your hand stays there as you're turning. The following will be your internal rotators. You're still going to use the door. It's just a different way to perform this. Same kind of exercise, but on this one, you want to keep it at 90 degrees. And now, what you want to do is turn your body away from the door. So that way you're moving your hips and also your shoulders away from the door. That way you should feel it on your chest, where I'm pointing, and also on your shoulder. Okay, this one's called your pec minor stretch. You have two major chest muscles, your pec major and pec minor. Not many people know that. This one's an important one. So you want to interlock your hands, squeeze your shoulder blades, and pretend that something's weighing you down. So you're pushing down. This will stretch your pec minor. So interlock your hands, push down. You should feel a stretch on your chest. This is a good one, especially for improving your posture. Horizontal shoulder abductors and capsule. Now, if you have a rotator cuff injury, this one will be a good one for you. The capsule is kind of the ball of liquid that allows the joint to move. So that's pretty much what you're stretching. And you're also stretching your deltoid as well. So keeping your hands straight, one elbow underneath, you're stretching the right one. And you want to perform this one on the other hand as well. Horizontal shoulder adductors and capsule stretch. Now you're doing the opposite. You need the help of a wall. So you stretch the posterior, now you're stretching the anterior, the front capsule. So in this one you should feel a little bit deeper, more than the other one, than the chest one that you performed earlier. And this one will help, especially with rotator cuff injuries, because you don't want to press the capsule. That's usually what causes a lot of pain. By pressing the capsule, so you want to be able to stretch it out and make sure it has full range of motion. This one is more rotator cuff stretches, internal rotators. Internal rotators include the subscapularis. It's one of the muscles in your rotator cuff. And this one's pretty easy. You hold on to the door and then you turn away from it. So you want to feel the stretch inside, near your shoulders. Shoulder external rotators, also part of your rotator cuff complex. Two muscles that you're stretching your rotator cuff, your teres minor and your infraspinatus, I believe. Yes, that's it. Now you want to make a fist, keep it behind. Now you should feel it right there where I'm pointing. Now as you're making your fist, pretend that you're going forward with your hand. It will give you a deeper stretch. If it bothers you, don't do it. Just make sure that you feel mild discomfort, not pain. Shoulder adductor and extensor. Now this one you also have a superior and inferior capsule. So you want to be able to stretch that for a full recovery of your rotator cuff injury. This one's also, you might have seen it, it's also a lat stretch, a tricep stretch, but it is more in an inferior capsule stretch that you're trying to prevent anything from happening or any muscle touching that capsule, because it does hurt if you ask anyone who had a rotator cuff injury. So you should feel it on your tricep and all along your right side. Shoulder adductor and capsule stretch. Now you're stretching the superior. It's also neck. You're stretching your levator, scapula, and also your deltoid. So you're going to feel in that neck region. Now what I want you to do with the opposite hand, you're stretching the right side. With the left hand, you're going to grab it behind your back. I want you to push it down. As you're pushing it down, don't let your shoulders from tilting. Make sure that they're still even. You should feel major stretch on that top of that side, and you can see the muscle fibers as I'm stretching it. And once again, you want to stretch the opposite side. So every stretch perform always on the other side as well. You want to perform this most days of the week, if not every day. If you have any questions, comments, or concerns, please let me know by dropping an email or comments. And you can check more videos, more rehabilitation videos and stretches, and also workouts in my channel. See you guys later. Thank you guys.